We have decided as a country to live with this virus, and Australians have worked so hard to ensure that we can.
That was the dream, but COVID clearly has other plans. Little bastard. Just 2 days after Queensland's grand reopening, 2 Virgin flights were classified hotspots. Today, authorities backtracking on an initial 14-day quarantine for nearly all passengers, instead requiring them to isolate until they receive a negative result.
I've been advised this morning that the Chief Health Officer and the deputies have viewed that we can apply the normal rules in relation to these flights.
In Melbourne, one Omicron positive cases night out across 2 clubs has dropped around 700 people into ISO. And while indoor masks remain mandatory for now, the vaccine mandate for non-essential retail lifts at midnight. In New South Wales, another huge jump in daily case numbers. 1,360, up from 804 yesterday and 536 the day before, prompting this prediction from the Health Minister.
By the end of January, we could be looking at 25,000 cases of the virus every single day. So that takes us, on my maths, to about 175,000 in a week.
But they ploughed ahead with a planned easing of vaccine and mask mandates, seemingly against the Chief Health Officer's wishes.
I think the Minister's given such wise advice and all I can do is echo it. I would urge everyone to continue to wear masks in indoor environments.
A vaccination has been the key for us to being able to open up safely.
But vaccination was never a magic bullet, even before Omicron. This warning overnight.
Vaccines alone will not get any country out of this crisis. It's not vaccines instead of masks, distancing, ventilation or hand hygiene. Do it all. Do it consistently. Do it well.
So between throwing off the shackles and keeping our guard up, can we keep from tipping off the tightrope?
World Health Organisation COVID-19 advisor Professor Mary-Louise McLaws is way too classy to say, "I told you so," but Mary-Louise, give it to us straight. Is Christmas cancelled?
No, Christmas should not be cancelled, Hamish, but what we should be doing is getting together safely. And by that I mean making sure you've had your booster shot, wear your mask when you're shopping for Christmas presents, and try to socialise outside as much as possible.
I wonder whether we're getting too, I suppose, impacted or anxious about these numbers. They are large numbers, given that the hospitalisation numbers are still pretty low. 166 in New South Wales, 24 people in ICU. Is it fair at this point to say, you know what, these are big numbers, but it's maybe not that bad?
You have to remember in New South Wales, it's very different from Victoria, and there seems to be a 2-week delay in seeing the rising of hospitalisation. So we will see it. The more Omicron we get, the more cases we get. It's just pure maths, but a delay. The UK and Denmark and Norway will be able to teach us a lot about whether or not we will be seeing more people going into hospital. But remember, at the moment, most of the young have got Omicron. And once it starts going into the elderly, then that number of cases in the hospital may increase and deaths may increase as well. So please go to your GP and ask for your booster shot earlier, because earlier is the best.
Mary-Louise, I've booked in for my booster shot, but I need you to help me to understand these numbers. So 25,000 daily cases by the end of January does sound scary. Do we need to conquer our fears? What does it mean on a day-to-day basis?
25,000 cases is just a little over what we would expect if we were going to follow the UK pattern, which is about 51,000 to 59,000 cases per day. That's a huge amount. So I think what we have to understand is that we have certain controls to help us reduce the morbidity and the mortality. So rapid antigen test for free, using them often, getting your booster shot, wearing your mask until we start seeing more of Australians, particularly the 5 to 11-year-olds vaccinated and the rest of the world vaccinated.
But do those numbers mean that hospitals are going to be overwhelmed? This is what I don't understand. I always thought we were supposed to look at numbers in hospital rather than numbers of people testing positive. So at what point do we do that?
Look, I like looking at both, because just because you haven't been hospitalised doesn't mean you don't feel as if you've been hit by a bus. But certainly if we're going to get 25,000 cases per day, the proportion of cases going into hospital will eventually overwhelm us. And then we will start seeing more deaths because people won't be able to get to hospital, and also won't be able to get to hospital for non-COVID related issues.
Well, you're part of the team coming to grips with this new variant. What's the strangest thing you've discovered about Omicron?
One of the things that I find quite remarkable is the theory that Omicron has an ability to charge the spike, to have positive and negative charges. And if this is the case, then as we're expelling it while we're talking and laughing and singing, then it can hook onto, mucus, polysaccharides, and remain charged in the air with these other particles, so that potentially we're more at risk of airborne spread. And that will be problematic. That's why I'm saying to people, please socialise outside in case this is true.
Thanks for scaring the hell out of me, Mary Louise.
Although there is an upside. If you wear your mask at Christmas, you don't have to get kissed by your creepy uncle.
That's
so
true.
the masks have a real life use.
That's true.
Mary Louise, thanks so much for your time tonight.
Please stay safe.
It's interesting, isn't it, when you're talking through the numbers like that, it still does make my mind boggle, and Mary Louise explained it. But the thing that I feel about COVID, it's like a naughty child. Just when you feel like you've got it sorted out, it goes and changes. Ha-ha, I've changed everything up again. So I guess it's about keeping all of the different parts of the prevention.
And people are getting tired. There was that message about it's going to get to the point where daily case numbers don't matter. Like, that was what a lot of people were saying. And that was, when we're moving towards a vaccinated population. And now we're back to thinking, oh, my goodness, New South Wales is over 1,000. So that fear's back. And then you're like, but I thought we were supposed to be OK and we're 90% vaxxed. And what is going on? I think people are confused.
I reckon we've loved having a target to meet in Australia.
Yeah.
Initially it was kind of keeping the numbers down or, at zero. Then it was getting the vaccination. We've actually, as a community, I think we've shown that we can really work towards that. I think where it does start to get confusing is you kind of hit the target, we're above 90% of over 16s, and suddenly it's like, oh, well, all those things you thought you weren't going to have to do anymore, maybe you do. I can understand why people feel that tension.
Totally, of course.
And the disappontment as you come to Christmas, the scariness about, will we have another Christmas that's going to be ruined?
I want to hug everyone, even the weird old uncle.